In this video, I'm going to show you how the treatment companion mode works and why you need a treatment companion. Before you take your therapy every evening, 1 hour before bedtime, you will log in and click on the Begin New Exercise button, which is right here. This takes you to a new screen which prompts you to indicate whether you'll be taking your therapy with or without a therapy companion. Part of the rationale behind the therapy companion mode is that you need to concentrate on the therapy without distraction. The uninterrupted flow of each session is crucial to your success in the long term. You achieve more effective and quicker results when you don't have to stop and score your response. Aside from that, your companion will not only score the results, but will also make a short list of particular words for a short exercise that you'll be able to take anytime the next day. We provide your therapy companion with instructions on how to do that. We understand that there may be times when your treatment companion is not available. If that is the case, you will select the solo mode. Please review the solo mode instructions to learn how that works. Keep in mind that it is essential to have ongoing support during therapy. If you have ever had rehabilitation or other medical therapy, encouragement and realistic feedback on your progress is very valuable. It is no different with Neurova. Now go ahead and click the Treatment Companion button. Let's look at the next screen. Here, Neurova is building your therapeutic exercises. This is a very complicated process which takes a couple of minutes. While you're waiting, you'll be able to review very helpful information. Each time you're on the screen, you'll have access to recommendations, tips, and specific advice that are valuable to you at your current progress level and in general. The timeline you see here keeps track of where you are in the process. Remember that your highest levels of improvement in comprehension will occur at or after 12 weeks of therapy. Your success is partly dependent on whether you take your therapy as prescribed and when prescribed every day. This means that the days you miss are counted against your progress. Miss a day and you move back. In the retraining, renewing, and restoring process, the brain positively reacts to the sequences and structures of the therapeutics. When you miss a day, you change the dynamics of the rebuilding process in the nerves. When you miss sessions, your therapy will take longer, which is exactly what happens with any other type of medical therapy. Lastly, at the very bottom of the screen, take note of the status area. It keeps you informed about what Neurova is doing at the moment. When the exercises are ready, the calibration screen appears. It prompts you to calibrate the sound level of the therapeutic exercises. It is easy to calibrate or adjust the volume of your computer speakers. When you purchased your Neurova treatment subscription, you received a sound meter. You will use it when the calibration screen appears. It's simple to follow the instructions on the screen. First, turn on the sound meter. Next, make sure you are seated approximately 3 feet from the speakers. Third, hold the sound meter close to your head. Fourth, click the Play Tone button on the screen. When the tone sounds, check the display on the sound meter to see how loud it is. And sixth, adjust the volume on the speakers until the sound meter reads 65 decibels. When that's done, click the Continue button. After you've made that adjustment once or twice, it'll become automatic. Next, you will see the Treatment Companion exercise screen. You will notice a message box in the center of the screen. It prompts you to make sure that the patient is not able to see the computer screen. When you hear the word to be repeated, the treatment companion will see the word at the same time on the computer screen. So, when the patient is ready, the treatment companion will click the OK button to begin the session. The Neurova voice will prompt the patient by saying, "Repeat the word," and then say the word, which the patient will repeat as quickly as possible. For example, the patient will hear, "Repeat the word change." At the bottom of the screen, the treatment companion is prompted to check whether the patient repeated the word correctly. The treatment companion will click yes or no. As soon as the treatment companion makes that selection, the Neurova voice repeats the process with the next word in the session. If the patient or treatment companion needs to pause the session, just don't select yes or no. As soon as you are both ready to go on, select whether the last word was repeated correctly or not. The session will continue. As the session continues, the exercise count is shown at the top of the screen here. The therapy companion knows how many more words are left in the session. When you have repeated the last word in the session, your screen will display your results. Depending on the kind of session you have just finished, this screen may have not only the results of the session, but other information as well. Notice the missed words section here. After each session, the treatment companion will select either 5 or 10 words from this list which the patient has missed. When the companion has finished selecting the words, they'll be used as an additional exercise to supplement the day's session. After each session, the treatment companion will give the patient this short list of words. Anytime during the next day, the patient will take the time to repeat each word multiple times out loud. Throughout the day, and when it is convenient, the patient will take a minute and select one word. Repeat each word quickly or slowly, and either loudly or quietly, but repeat every word once every day. It is important to vary the way you conduct this self-paced exercise. If your treatment companion gives you 5 words, repeat one each 10 minutes, one right after the other. If you receive 10 words, repeat each one of them 5 times during the day. After you have reviewed the screen, please click the Save button. The last screen in the treatment companion mode is one that advises you when to take your next exercise session. You can conduct multiple sessions at any time, and it will certainly help to do so. But the most important thing to keep in mind is that your main session must take place 1 hour before bedtime. This is because the brain's rebuilding period is activated while you are asleep. In the daytime, your supplementary exercises will help you to consolidate both types of memory that are highly dependent on healthy synaptic junctions to assist you to rebuild your fluency. The more you do, the better you'll do. It's important not to become frustrated if you respond incorrectly. There are many reasons why that is to be expected, even if you think you should be doing better. Stay focused, stay patient, and recognize progress when it does occur. Your treatment companion will be a better judge of your improvement in the early weeks than you might be. So respect the comments of your treatment companion when those types of subjects come up for discussion. When you click the Continue button here, it takes you back to the main screen where we started.